What are we looking at? Okay, so marginal zone lymphoma, and it's going to be associated with your chronic inflammatory states. So let's do this practice question. We have a 52-year-old woman presenting with persistent dry mouth and dry eyes. She also has her painless swelling under her jaw and salivary glands reveal your B-cell lymphoma. Which of the following best explains the pathogenesis? Okay, so the marginal zone is formed by post-germinal center B cells. And so whenever we have a marginal zone lymphoma, then we can get or have associations with Hashimoto's thyroiditis, Sjogren's syndrome, and H. pylori gastritis. Okay, so let's talk a little bit about this. Basically, marginal zone lymphoma is a slow-growing cancer that comes from a kind of immune cell called a B cell. And it happens in places where there's been long-term inflammation and chronic immune activity. So think of it like this. If your immune system is always fighting, it'll sometimes make some mistakes, and one of those B cells will turn into cancer. So what causes this long-term inflammation? Well, like Sjogren's syndrome, it'll make your mouth and your eyes dry, and it affects your why did I say salivatory glands? Your salivary glands. I'm a silly goose. Hashimoto thyroiditis is when the immune system attacks the thyroid, right? And then H. pylori is the bacteria in the stomach, which causes the ulcerous inflammation. So over time, constant inflammation, just so much inflammation, creates a special zone in the tissue called a marginal zone. And that's where the B cells gather, and that's where the cancer starts. And so what is MALT lymphoma? You've probably heard of that. It's a type of marginal zone lymphoma that grows in the mucosa, like the stomach lining, and it's linked to what? H. pylori infection. And so a marginal zone lymphoma is a B cancer from the chronic inflammation. It's caused by autoimmune disorders or long-term infections. It's called a maltoma when it happens in the mucosa of the stomach. Examples would be Sjogren's, that's salivary glands, Hashimoto's is thyroid, and H. pylori is the stomach. All right, so now back to our question. A, Epstein-Barr virus infection of the B cells. That would be Burkitt's lymphoma. Burkitt's, right? Not marginal zone. T cell. Marginal zone lymphoma is a B cell cancer. So thanks for playing. D, let's look at that one. Defective apoptosis. That would be your follicular lymphoma because that's associated with the BCL2 gene. So the MYC translation, what is that? What's the MYC? That's going to be Burkitt's lymphoma. And so these guys, E and A, are similar. They're both in Burkitt's, not marginal. Yeah, so what you need to know about the margin is the relationship with Hashimoto's, Sjogren's, and H. pylori. It's autoimmune or associated with inflammation in the germinal centers, the post-germinal centers, where the B cells will gather and aggregate, and it's a type of B cell non-Hodgkin's lymphoma. And the only other thing is just know that Epstein's-Barr is Burkitt's lymphoma seen in kids, and then T cell activation, it's just a B cancer, and follicular as is defective apoptosis BCL2. That should be everything. Yeah, that should be all. That's like 1 point on the exam for you.